Hello and welcome to Fighting COVID. As you all know, that Delta variant has been making headlines across the globe for quite some time now, and in many countries, including the US and India, Delta variant has been dominating. Therefore, we will be talking about this particular variant today. Last week, His Excellency Dr. Ahmed Al-Saidi, the Minister of Health, in an interview with Oman TV, made it very clear that most of the infections are of the fast-spreading Delta strain, which affects all ages and is unfortunately more severe than the previous variants. The World Health Organization said that Delta, which first originated in India, would be the dominant strain in the world in the months to come. It has been recorded in 124 territories, 13 more than last week, and already account for more than 3/4 of sequenced specimen in several countries. The global number of new COVID-19 cases reported last week from 19 to 25th July was over 3.8 million, an 8% increase as compared to the previous week, the UN Health Agency reported last week on Wednesday. The latest data from the World Health Organization showed a substantial uptick in the Americas and the Western Pacific, which jumped 30% and 25% respectively. An average of around 540,000 cases were reported globally each day over the past week as compared to 490,000 cases reported daily the week before. The number of deaths reported this week increased sharply with over 69,000 deaths, a 21% increase when compared to the previous week. The cumulative number of cases and deaths reported globally is almost 194 million and over 4 million respectively. WHO said that over the 7 days, the highest number of new cases was reported in the United States, which saw more than 500,000 new infections, representing a skyrocketing 131% increase. The Delta variant has led to a surge in coronavirus outbreaks, triggering a fourth wave in the Middle East, where vaccination rates remain low, said the WHO. In fact, in a statement on Thursday, the global health body said the circulation of the Delta variant is fueling the surge in COVID-19 cases and deaths in an increasing number of countries in WHO's Eastern Mediterranean region. It is now being reported in 15 out of the 25 countries of the region. The Delta variant is becoming the dominant strain of the virus in several of these countries, with infections mostly being reported among people who have yet to be vaccinated. It is more transmissible than the original virus and other detected variants of concern, it said. Infections have increased by 55% and deaths by 15% in the last month compared to the month before. More than 310,000 cases and 3,500 deaths have been recorded weekly. In view to that, India once again extended the ban on international flights till August 31st midnight 2021. This comes amid increasing cases of Delta variant of COVID-19 throughout the globe and with the fear of a third wave of the pandemic looming large in the country. All international flights to and from India have been banned since March 23, 2020 due to COVID-19. It was initially planned to end the restrictions on international commercial flights on July 31, 2021. Despite overall restrictions on international travel, some flights are allowed to operate to repatriate stranded citizens and other eligible cases. Flights that come under the air bubble agreement are also allowed to operate. India has entered into air bubble arrangements with countries such as the United Kingdom, the United States of America, Bhutan, United Arab Emirates, Kenya, Maldives, Nepal, Rwanda, Ukraine, Kuwait, Uzbekistan, Germany, Nigeria, and lastly, France. Somewhat similar situation of Delta strain is being faced in Pakistan. In fact, Pakistan's largest city, Karachi, has undergone a week-long partial lockdown starting from Saturday to curb the spread of the coronavirus Delta variant, as the city's hospitals are close to saturation levels. Last week, Pakistan's federal government announced a ban on staff entering public offices, schools, restaurants, transport, shopping malls, and air travel without vaccination certificates, despite only 2.7% of the population having had the full 2 COVID-19 vaccine shots. According to Al Khan University Hospital, one of the most reputable hospitals in the country, there is almost 100% prevalence of the Delta variant in the city, the chief executive of the province said. And as I mentioned earlier on the midday update, that the capital city of Pakistan, Islamabad, is under a smart lockdown in various sectors due to a surge in the number of COVID-19 cases starting Sunday. According to a notification issued by the Islamabad District Magistrate, the movement of residents will be restricted in 27 streets in different sectors with a high COVID-19 positivity ratio. Now, in terms of the contributing factors to the growing Delta variant, Dr. Maria Van Kerkhove, who WHO technical lead on COVID-19, said that there are a number of factors adding to increased transmission around the world. We'll be touching on these variants after this quick commercial break. Welcome back to TTV, watching Fighting COVID. Now, before going on a quick break, I mentioned that we will be talking about the contributing factors, and according to Dr. Maria, the first are these variants of concern, including the Delta variant. The second factor is that we have increased social mixing and increased social mobility, which increases the number of contacts that individuals have. The third factor is the relaxation of the inappropriate use of public health and social measures. Proven public health and social measures that we know prevent infections, reduce the spread of somebody who is infected with the virus to others, and saves lives. And the fourth factor is the uneven and unequitable distribution of vaccines. According to a recent report by DW News, researchers say 2 shots of either BioNTech, Pfizer, or AstraZeneca vaccines are highly effective against variants. This is as per a study published in the New England Journal of Medicine has found. The article published in DW last week stated that the BioNTech Pfizer shots were 88% effective at preventing symptomatic disease as compared to 93.7% against the Alpha variant. The study reiterated the importance of taking both of the shots to achieve immunity. 2 shots of AstraZeneca vaccine were 67% effective against the Delta variant, up from 60% originally reported, and 74.5% effective against the Alpha variant. Only modest differences in vaccine effectiveness were noted with the Delta variant as compared with the Alpha variant after the receipt of the 2 vaccine doses, researchers wrote in the study. In fact, scientists had previously noted that a single dose of either vaccine was 33% effective against the Delta variant. This was all from our Fighting COVID studio today, but stay tuned as we'll be coming next week again with more latest updates and news in terms of COVID your way. Keep watching TTV.